to allow
Sorry, I
medication
forgot to record. Sorry.
allow medications to go out throughout the hospital course. And more specifically, for something so meter dose inhaler, most of those have 200 puffs per inhaler. The standard dose is 2 puffs. So if you're in the emergency department, you may get 2 or 3 doses, which would be 4 to 6 puffs. If that gets thrown away, that means 96, 98 of those doses are getting thrown away, which is just criminal. And when anything gets thrown away, that HKA is going in the atmosphere. So whether the patient uses it or gets thrown away, that's all going in the atmosphere. So this is a significant problem. Next slide. So the current policy that medications have to go home really makes absolutely no sense. It contributes to both physical waste, as we talked about, and it's really expensive. It's a total waste of precious healthcare dollars just to throw perfectly good medications away. It's horribly inconvenient for a patient. A patient has just had a stressful visit to the emergency department. Instead of putting their medicine in their pocket or their purse and going home with it, they've got to go to the pharmacy and buy it. And for many of our patients who visit our emergency departments, which is the portal of entry for most of our uninsured and underinsured patients to our healthcare system, it's a huge equity issue. Instead of giving them medication that's already been paid for and going home with it, now they've got to pull out their wallet and buy the same thing that just got thrown away. So the current policy really is ridiculous. And I've got, I think, 1 or 2 more. Yeah. And so the bill 447, Assembly Bill 447, introduced by Assemblymember Gonzalez, would allow healthcare providers to dispense the remaining doses of non-narcotic prescriptions to emergency patients, room patients. Next slide. And those medications are often in the emergency department dispensed in multi-dose packaging, leading to leftover doses. So in addition to inhalers, also things like eye drops and liquid antibiotics. So that's the end of my introductory presentation.
Thank you, Bill.
Oh, and just to add, so when we met with the staffer, they said so far they had heard no opposition to the bill. This is a really logical bill that's not going to cost the state any money and got out appropriations without even a discussion. So we're optimistic this bill can pass.
Yes, absolutely. And Lisa and Jillian are going to help make that even more clear, and Erica. So thank you, Bill, for that review. Are there any questions so far? No? Okay. I guess I would just want to highlight what came up on the last time we were discussing this, and Julia, especially for you. As I remember, so Kyle is in Assemblymember Gonzalez's office, and I remember him saying that, this could be the first iteration, and then perhaps, and Bill, you talked about this too, perhaps in the next year, it could be hospital meds, that patients could take meds home from the hospital. So it could be sort of the entry point to making bigger rational changes, which is exciting. So I'm going to pass it now to Lisa and Jillian to talk about the legislative cycle and where it is right now.
So, hi, I got most of this from Lisa. So, Lisa, if you want to chime in if I do something incorrect, but on the right, it shows how bills become law, that it's introduced on the floor. So, this bill was introduced in February of this year. Then there's a rules committee that assigns the bills to other committees. So, it was assigned to business and professions, health, and it passed both of those committees with no opposition. It went to appropriations. Again, it passed without any opposition. So then it went to the consent calendar, which is where I understand non-controversial bills go. They get batched together and then they can be approved in one vote. So Lisa recently called and said, I think it's still, I didn't quite understand, it's still waiting for the assembly floor vote. And obviously, if it passes, if it passes the assembly, then it has to go over to the Senate and go through the same process with being assigned to committees and voted on. So fingers crossed that it's making its way slowly but surely through the process.
Yeah, fantastic. Thank you, Jillian. Would you add anything? So it was introduced in the assembly, that's its house of origin. Would you add anything else to that? Lisa?
Oh, oh, that was great. You know, AB bills are assembly bills, so they're introduced in the assembly. And so if you see a bill with an SB, that will have started in the Senate, but wherever it starts, it has to go through the committees, a floor vote, then over to the other house, committees, floor vote, and then hopefully it'll pass and go to the governor. And then if the governor does not veto it, most bills become law the following January. So very excited about this bill that everybody seems to be agreeing on so far.
Yeah. Let's see. Layla said you have a question?
Hi guys, this is Lila
Hi.
Hepchi. I'm one of the anesthesiologists at Oakland Kaiser. I'm so maybe I'm looking at this wrong because I'm basically on the Legiscan website that has the text of the bill. And it's just the language is a little confusing. So I just wanted to just make sure that we know what we're advocating for. There's like, and maybe I'm looking at the wrong thing. I'm not sure. So I'm just looking at like small print that like has the bill text that there's like amendments to the business and professions code, and something about like how the hospital pharmacy has to be closed for this to be happening. I'm just confused. I don't know why all of this extra language is in here, and maybe I'm looking at this wrong, but I'm just curious if anybody has any insight into that.
Yeah, Bill, go ahead.
I do, because I got confused by the same thing, and I actually asked Kyle Gonzalez staffer about this. So
Okay.
the way that site shows what you're looking at is the current regulation. So
Yeah.
currently you can only, you have to have, it has to be compounding pharmacies that aren't open, your pharmacy's got to be closed. There's all these regulations to allow medication going from the emergency department. That's all listed in the beginning of that webpage. And then below that is the language of this bill, which is very close to what the summary that we showed. So I found that incredibly confusing until that was explained to me as well. I don't have that site open right now, but I think that's what you're looking at.
Okay, that's great. I'm glad that you were confused by it and that your questions were
Yeah.
answered.
I was totally
Thanks.
baffled. I was all up in arms with the staffer, and he explained that to me, and then I felt like,
Good
Awesome.
point, good point.
yeah,
Thanks so much.
it's not at all obvious the way that it's on that page. So I agree. It's looked like a really horrible bill till I always explain that's what that's.
Appreciate that. Thank you so much.
That's funny because, go ahead, Lila.
I do have another question. I think it'll be about implementation once this is passed. So, but that's maybe like a little bit farther in the future. So that can be shelved for another day for sure.
Okay. I think one of the other themes that came up around the conversation last time we talked about this was how irrational the current process is, to throw away a fine inhaler. And it sounds like that was reflected in what you saw on the details of the bill. So
Well,
yes, this will help.
The rationale for the current regulations, I believe, is number one, there are regulations that a new medication dispensed to an outpatient, the patient needs to be educated on the appropriate use and the side effects. And so the current regulations are partially to make sure that happens, which is good. But I suspect another part is because hospitals get a huge discount on medications they purchase. And what we pay at the outpatient pharmacies is way more expensive. So
Yeah.
I suspect the pharmaceutical lobby had something to do with this, and they don't want hospitals giving a patient $100 of 1 cent pills that they want to charge the patients 25 cents for each pill when they go home. So I suspect, even though no one really says that, that's part of it. So part of it is the education and medication labeling. I think part of it is protecting the bottom line of the pharmaceutical industry.
Any other questions so far?
Yeah, I have one. So yeah, I was also concerned about the pharmacy being closed since most hospitals have 24-hour pharmacies. But and so that's a relief. The other question I had is does anyone know if this is something that will no longer be part of the bill, that it shall not exceed a 72-hour supply? Is that no longer going to be the case? I can't tell what's staying from. I think I'm on the same page. That isn't very clear.
let me look that up and see if I can answer that.
Okay,
And
Thank
while
you.
you guys go on, and maybe I'll just put it in the chat.
Okay,
okay,
that'd be
sure,
great.
thank you.
Thank you, Bill. Great. Anything else? All right. Okay, so thank you, Bill, for doing that on the fly research. Appreciate it. And we can also ask Kyle, the staffer, if it's not apparent. So now we're going to go to Erica and talk about what we can do to help this bill be successful.
Great, thanks so much. I have a recommendation and then a question for discussion. So what you can do right now is to call and support the bill. The question that I have, and maybe Bill or Ashley, you can speak to this, is kind of the timeline in general, knowing that the session itself, kind of like where we are in space, but how we make the most of our outreach. But you can find your assembly member online. And so call your senators, call your assembly members, and let them know that you support this common sense bill to reduce pharmaceutical waste. I think that there's a script if you wanted to screenshot it, and it's on the next slide. And fill in the blanks here, but here's a nice little script, and it has the bill number. I think very importantly, you should say what kind of medical professional you are, if you have one of those in your name, because you speak with authority, and then really talking about saving people money, increasing access to care, reducing healthcare waste, and addressing healthcare climate pollution. I'll pause there. One thing that Ashley and I were kind of chatting about was this is a really great thing just to educate people for if you are in a workplace for general interest. I think a lot of healthcare workers calling will probably be a great thing. So I'll pause there.
Awesome. Yeah, it would be interesting and useful to see if people want to put who their assembly member is, just so we know who we're calling. I'm Assembly Member Wicks. I know that. And if anybody needs help looking up your yeah, Lisa Bowercon, Kahan. If anybody needs help looking it up, and I thought it was just kind of interesting that in the Sacramento legislature, there are 40 senators and 80 assembly members. And like Jillian said, this bill, it's any day, we don't know which day, but between now and June 6th, that's when the bills have to be voted on in the House of Origin, so in the assembly for this bill, by June 6th. So it will be between, in the next 2.5 weeks or 3 weeks, I guess. And so that's what our ask is when there is a floor vote that they vote to support it.
Perfect. Thank you for clearing that up.
Yeah. Haney, nice. Yeah, so we can the idea was literally to look up your assembly member, and I don't know all of their, if you do this, does it tell you their phone number? Let's see. The idea was really to take a minute right now and call them, because we're all so busy. It's hard to keep track of these to-dos. So yeah, there's their number. So let's go ahead and do it. I'm gonna make a call, and then we'll just wait until everybody's done, and we'll circle back together. And I'll put the script up while we are calling. And just go ahead and put yourself on mute. So maybe just put some emoji in the chat when you're done calling. Lila, maybe you can call up our shared member Wix after on your way home and let her know. Awesome. Good job, Megan. Whoop whoop. Let's give it another couple minutes.
Our agents are busy helping other customers. At the tone, please record your message.
That's funny. Oh yeah. What does PNT stand for, Lila?
Pharmacy and therapeutics.
Yeah. Oh, that's a good idea.
Yeah, I'm the recent ex-chair.
Oh, what do they call that? That has another name, doesn't it? Post.
I don't know, emeritus?
Yeah, exactly. The chair emeritus. I love it. That's a really good idea. And that kind of gets at what Erica brought up as an idea, which we kind of wanted to mull over together, is how can we, like this could be something to bring up if it's not already being talked about, at health systems, government relations teams. They may already be talking about it, but it wouldn't hurt to bring that up. Yeah, Megan, you said you'll share it with your external affairs department. Exactly. So same thing. And I guess I would be happy to make that as easy as possible. I could share the fact sheet about it with everybody if that's helpful, to the text to our email. Oh, yeah. Sorry, Lori, do you mean the text of the script to call?
Yes. Yes,
Okay,
please.
yeah, I could do that. Yeah, so I'll share the script to call. Actually, this is already in the works, this email. And then the fact sheet is also being shared. So this is already in the works. I'm remembering. But this is a really great idea. If you are part of a health system and you want to, reach out to whoever's in the government relations or external affairs and just say, this is going through the legislature. I think this seems like a great thing for health systems to get behind in the interest of, patient saving money and healthcare and waste. Could we take a position on this? And it's a good way to just build relationships too with those people for future things. So great. Awesome. Lisa is doing a double header. I love it. She's bringing up other bills. So Lila, you have another question?
So the older I get, the more I need to temper my enthusiasm and advocacy with the sort of this caveat. Are there any blind spots or detractions or unintended consequences that we can imagine this bill would cause that we do not potentially see right now? Does anybody have any thoughts about any potential downsides? I'm curious because, right, who would be in opposition to this besides the pharmaceutical companies? But would there be any roadblocks to either, enacting this, implementing this, or what are the, are there any unseen, unintended consequences of this happening? I can't see any, but I just want to make sure that that we can answer those questions, or if anybody has any fears about that. The CFOs.
In the chat, yeah, who opposes it? Yeah, just looking at it from all sides, I think is a very good idea in any advocacy. The CFOs, Marla, to your point about what Bill was saying of how hospital pharmacies can charge more to uninsured patients than what the hospital pays for medicine. So yeah, I can't think of any others. Support, opposition, none on file, is what Lisa's sharing for, so this is like
That's from the
the,
bill analysis in the health committee from Ledge Info. So that's nice to see that nobody signed on in opposition.
That's
Sure.
consistent with what Kyle told us too. And I
Mhm.
expected the pharmaceutical industry to maybe pick up on this, but this may be too small for them. So
Yeah,
that's why I'm really optimistic on this one.
yeah, and also bad PR. Um, so your point's a good one though, Lila, and I think, that's a good practice to always be in. So let's see, any other ideas, comments, questions?
I just want to add that I went back and looked up the legislan. Yes, in that stuff about 72-hour dosing and the pharmacy having to be closed. That's the old current regulation. So that's not in. And if you look at section B on that, which is just like 3 or 4 lines, that's basically what this bill does, which is very clean and simple, says that you can take your medicines home with you.
Great, thank you.
Yeah. And I'm realizing I put the wrong form in the chat. That's a good form, but that's to evaluate the meeting. So if you want to get involved in advocacy, I'm going to look for that form, which is a different one. So yeah, if you use that, that's great because it'll tell us what you think, but I need to offer you a different one. So I think we're gonna go ahead and round out, and maybe you'll even have like a time for yourself to breathe before the next thing at 1. But the things that are coming up soon are this coming Tuesday in Sacramento. There's a big rally happening, and Climate Health Now Action Fund is just part of a huge coalition that is working to advance the Make Polluters Pay Climate Superfund bill. So this is a different campaign, but similar spirit of, addressing climate change to protect people's health. So that's going to be in Sacramento next Tuesday night. And if that's of interest, and Megan, I'm going to reach out to you, then let me know. You can also just take this form and fill out the RSVP. It's a general RSVP for the whole coalition. So I won't get it, but this is one way to get updates about that. And then 2 other things that Climate Health Now are offering is, one is a Polluters Pays Climate Superfund economic and legal consideration webinar. So this is just getting more educated, because that same campaign, the Polluter Pays Climate Superfund bill, it's a bill like that has been introduced and passed in New York and Vermont. Those are not petro states, so it's a different situation. And the oil lobby is funding a lot of advertisements to disinform the public, saying that if this bill passes, then it will increase the cost of gas, which is something to be worried about. And we have reason to believe that that's actually not true, which never stops them, but that's the message that people are getting. So what we want to learn is, how is that not true, and what are the facts? And so we're going to have that discussion on Monday, June 2nd, about the economic analysis of what this bill will do, and the legal considerations also. So Maya Golden Krasner, she's a lawyer, and she's going to talk about the climate nuisance cases, like how the state of California is suing a handful of oil companies for misinformation and deception, things like that. So she's going to talk about how that avenue kind of is mutually is different, but pulling in the same direction as the Superfund. So it should be very interesting, and I hope you will consider joining. Let's see, I can put this is the link to register if you want for June 2nd, the kind of webinar about the polluter pay economics. And then I still don't really understand what a virtual power plant is, but I want to. And if you want to, then you should join on, this is Wednesday, June 4th. We're going to talk about virtual power plants, the ABCs of VPPs, and why they're part of a climate solution portfolio, and how they can help to help us to use electricity more efficiently, so that we don't have to use dirty peaker gas plants by distributing load, basically. So you can come learn a lot more with me. And the speaker will be Woody Hastings, who's the Phase Out Polluting Fuels Program Director at the Climate Center. He's a really cool person who's done a lot of great leadership. So those should be really fun. We're going to get smarter together, keep on doing that, and having fun doing so. So I hope you can join. And let's see, what else? Any other announcements you want to share?
Just
have one-
quickly, I took the opportunity to ask the staffer that I called whether I could send him an invitation to our upcoming
Oh.
webinars, because it would be so cool if staff people from the
Ah.
offices attended.
I love it. Love it. Did he say, yes, send me an invite?
Sure, yes, absolutely. Send me an invite, and gave me his email. So
That's
why not,
great.
right? Yeah,
Good. I love
more
it. Making the most of
education.
these calls.
Yeah.
Great.
No, we're gonna call me as well.
Yeah. Bill, I'll get back to you about the 28th. Not sure. Bye, Lila. So yeah, I think we're good. This was most of it. And I really appreciate Jillian. This was the first time that you've co-led a meeting, which is great. Proud of you. High five.
Well, yeah, lots of help, but
Yeah.
you make
Hey,
it
always,
easy.
always. Yeah, and thank you, Erica, for participating and leading. And yeah, I'm excited to follow up with you, Megan, and it's good to be with you all. So thank you.
I have one more quick question. Does
Sure.
anyone have, back to AB 447,
Yeah.
does anyone have sort of a sense of, assuming, it looks like it's gonna pass, the sense of when it's gonna be implemented? Does anyone know? Or is
Usually,
that just a huge question mark?
usually if it goes through the session and is signed by the governor, bills become laws on January 1st, following the
So
session.
that's not very far away.
Yeah.
Yeah,
Yeah.
okay.
It sure is not.
Right,
Okay.
but it
Life
doesn't
just
have 2 years, Lisa, because
It-
if it,
If it doesn't pass this year, they can bring it back for a second year, but if it passes
right, that's true. Yeah.
around, which would be great. And I would imagine that Climate Health Now could help write up the next bill, or
Totally. Yeah.
be part of that process. That would be very cool.
I'm picking up what you're putting down. No, I think that's an amazing idea. And we haven't done that because it's a big lift, but this is right at our intersection, right?
And it sounds like Bill and Julie have been working